Hi everyone, today I'm going to discuss generalized anxiety disorder, GAD, and specifically some of the etiology of it and treatment methods. Everyone at one point or another in their lives has felt some sort of stress, whether it is about school, work, or personal matters. Some say that a bit of stress can be a good thing. But what does distinguish your occasional stress with the disorder? Well, according to the DSM-5, there are a number of key symptoms, such as excessive anxiety and worry, which would be ongoing for at least 6 months, and difficulty controlling that stress. Now, of course, there is more symptoms and more factors that can go into it, but this is the main one that we'll focus on right now. So, what could possibly be the underlying cause for GAD? Uh, Different research has been done, and there are a number of factors which can be talked about as to where it came from. However, for this discussion, we'll strictly stick to anxiety sensitivity and white matter levels in the brain. So first we'll start with anxiety sensitivity. What is it exactly? It's the fear of anxiety and anxiety-related sensation, which brings us to a linking factor between the two called repetitive thinking. Repetitive thinking is as it sounds, it is the act of an individual who is compulsively focusing and obsessing over certain thoughts. Naturally, we can deduct that this could turn into a vicious cycle. It causes sadness and stress, and if you can't stop thinking about certain events and situations, of course, you might as well develop the fear of being stressed out and being anxious. Now we will jump to white matter. What is white matter? It is composed of largely myelinated axons, hence the white color of it. And because white matter is composed of myelinated axons, it helps speed up action potential firing, and it was taking great interest into seeing if the integrity of it influenced the disorder. Now, if we take a look at the pictures, we will look at the right one, which shows us an image of a DTI scan, also known as the diffusion tension imaging. Multiple studies found that using this type of technique was a good way to capture and determine the levels of the white matter. And indeed, research showed that compared to healthy individuals, white matter levels were low, specifically in the caudal anterior cingulate cortex, which is also shown on the left. It's highlighted in yellow, as well as patients also had lower integrity of the uncinate fasciculus. So let's take a short pause. The uncinate fasciculus, also known as the white matter association tract. A lot of information was thrown. Let's dissect some of it. It essentially connects the prefrontal cortex and the anterior cingulate cortex to the amygdala. And the amygdala's function is known to be associated with emotion. And if the tract is impaired, then it's safe to make the deduction that anxiety would be induced. Now let's look at how do we treat such a disorder. There are two approaches that I focused on for this discussion. The first one being CBT. CBT is also known as cognitive behavioral therapy. The concept of it is to train the affected individuals to be able to learn the necessary skills of managing symptoms and ways to think and behave to gain control over the excessive anxiety. Of course, it's easier said than done, but research has found positive findings that individuals were able to minimize that excessive worrying anxiety. Now, next we'll look at some medication choice, duloxetine, which is an antidepressant, and it affects noradrenaline and serotonin transporter molecules. This helps because of the release of those chemicals in the prefrontal cortex and hypothalamus. It in turn would be working on the amygdala and help control emotions, which if we go back circle to anxiety sensitivity and all of those factors, makes sense how it works. So to recap all this information, GAD can put a toll on individuals who suffer from it, and it's important to understand that there are a lot of other different possibilities and approaches on why and how did this disorder come about. However, there is still a way to go, and a lot has become clear, but hopefully future research will be able to pinpoint the exact cause. And here's a little pun joke. Thank you very much.